Hello and welcome to the Curated Beauty Podcast. I'm Jessica Christie, CEO of Beauty Culture Med Spa and the founder of the new functional and regenerative business, Cultured Wellness. From my start as a physician assistant to now not only being a practitioner but leading my own businesses, I've been on a unique journey through health, beauty, and entrepreneurship. Join us as we explore everything from skincare secrets to leadership lessons. Whether you're passionate about beauty or striving to balance life's challenges, this is your space to connect, learn, and shine. Let's dive in. Hello, beautiful people. This is Jessica Christie. Welcome back to the Curated Beauty Podcast. I am your host, and today we're going to dive into a topic that is incredibly important, yet very overlooked in the world of female health, and it's oral birth control pills. I'm just going to throw it out there. Oral birth control pills, and more specifically, how they affect your fertility and your overall health. So this episode is really going to be about information. It's about informed consent. It's about understanding the broader implications of hormonal contraception. So what is hormonal contraception? Well, it's synthetic estrogen and synthetic progesterone or progestins. And these were created to suppress ovulation and to prevent pregnancy. And let's start with a bit of history here. The pill first came out in 1960s. There was a significantly higher level of estrogen and progesterone than they contain now, but they were a great option for women who were wanting to prevent pregnancy and not have 11 kids by the time they were 33. If a woman wanted to stop having kids back then, she basically had to cut out the organ, cut out her uterus and be done. So this was really exciting. And it was a time in the feminism movement where women were gaining control over their bodies, and it was exciting. They actually had a say on how many kids they wanted. And when they first started taking these pills and were excited about this, they weren't having a menstrual cycle. There was none of that week of the placebo pills with the withdrawal bleeding. And we now see, looking back, women were confused by that. Sometimes they thought they were pregnant. They found out they were sad when they found out that they weren't pregnant. And essentially they decided as a marketing and scientific sort of decision that we're going to make bleeding happen at 28-day intervals. They could have picked any interval, could have been 75 days, 110 days, 10 days. But basically, they picked this because they're making women think in their psyche that they're cycling normally. They're just suppressing their ovulation. So how are we suppressing ovulation? Well, they're really suppressing estrogen, progesterone, and testosterone via the hypothalamus pituitary axis. And this essentially is shutting down your ovaries from producing eggs. And over time, your ovaries are not used. You use it or lose it, your ovaries are shrinking down to the size of menopausal women's ovaries. Oral contraceptive pills also affect the thickening and the preparation of your uterine lining for implantation. So now we're minimizing how much you're ovulating or releasing that egg. We're not thickening and proliferating for implantation. And so it can't support an egg, even if it was fertilized or dropped down. And also the oral contraceptive pills affect the cervical mucosa, making it inhospitable to sperm. So therefore, we have an effective pill at 99.7% effective at preventing pregnancy when taken correctly. So let's think. That is exciting. We talked about that. But what else is it doing to the body? Well, the biggest risk, and the one that we hear about in a scary way, is the black box warning. And any pharmaceutical medication that has caused death or issues such as this has a black box warning. And this is a warning for thrombosis, clots in the vessels. This can cause stroke, pulmonary embolism. Blood clots are anywhere in the body are going to block blood flow through a vessel, causing the distal tissue to die unless there's any intervention. So yeah, you could die by taking these things. There's an increased risk. It's been proven. But more commonly, what we're seeing is things like depression and libido. Why, you may ask? Okay, so depression is caused by the depletion of B vitamins that affect the metabolism of something called tryptophan, and therefore it's suppressing serotonin. And serotonin is our feel-good hormone. We also have low libido. low libido because our testosterone is suppressed. Even though we have 90% less testosterone than a man, it's still imperative for our overall desire for our vaginal lubrication. Also, there's something called sex hormone binding globulin, or SHBG, and that is increased when you take oral contraceptive pills or hormonal contraception. And essentially, you can imagine this like being a big magnet for the estrogen and the testosterone floating around, free version able to be used and uptake. And like if you think of a magnet and like those little metal shards like that you could pick up with the magnet, that's essentially what's happening. So when you have a high sex hormone binding globulin, you don't have a lot of free hormones that are able to be used by your body. Also, we have a common increase in difficulty orgasming. So if you have difficulty orgasming, why is this happening? Well, on oral contraceptive pills, and this is so multifactorial, but you have actual shrinkage of your clitoris by at least 20%. There's also atrophy of vaginal tissues, and this is going to be combined with the decrease in lubrication that you're experiencing from these decline in these hormones and really making sex unenjoyable. And so, hello, your libido is going to fall by that much more. Can you imagine men taking a drug that we told them that was going to decrease their penis size by 20%? I mean, it's like sort of a provocative question and obnoxious, but it proves the point and it highlights really the disparity in how we view side effects for men versus women. It also goes to talk about menopause. Like, it's just so crazy. So I think that it's just worth mentioning that. Also, the pill messes with your mind. We talked about a little bit with talking about B vitamins, how it can affect your mood and depression, but let's circle back to that a little bit and give you some numbers to support this. Women on hormonal contraception are 2 to 3 times more likely to be on antidepressant versus non-users. And you might think, oh, okay, well, if it's vitamin B that's the issue, I can just supplement my vitamin B. Well, yeah, vitamin B is crucial in treating women that have depression, actually. There's a lot of studies behind that. But to restore what's lost from oral contraceptive pill, you would have to take 25 to 50 milligrams of vitamin B daily to just get what you would need from being lost. And to give you a better idea, the RDA for women is, I think, 1.3 to 2 milligrams daily for women of reproductive age. And so really, it's crazy to think about how much you would have to actually give them. And not to mention that, but chasing around all of the other deficiencies. So there's a lot of nutrient deficiencies. Vitamin B9 or folate. Having a folate deficiency puts a woman at risk for developing a baby with neurotube defect if she's to become pregnant. And the prolonged use of oral contraceptive pills worsened the deficiency as well. So Big Pharma knows about this too. They started coming out with oral contraceptive pill formulations that actually include folate, although they deny feverishly that oral contraceptive pills actually cause folate deficiency. Well, then why are you putting it in there? Doesn't make any sense. Folate also really helps your immune system fight off HPV. We're going to talk more about this a little bit later when we talk about the increased risk of certain cancers on hormonal contraception. But yeah, HPV, 80% of women will have HPV by the time they're 50 years old, and your body typically will fight it off with the immune system. But when you're taking oral contraceptive pills and decreasing all of your vitamins and minerals, you don't have as strong of an immune system, and you are at a much, much increased risk for developing cancer, specifically cervical cancer. Also, let's talk about trace minerals that we're missing. So there's a major reduction in zinc, selenium, phosphorus, magnesium, and coenzyme Q10. These are very important for biological reactions that are happening in your body. And not to mention, you also have a higher need, or you need a higher level of vitamin C, vitamin A, and vitamin E when you're on oral contraceptive pills. Circling back to the trace minerals for just a second, selenium is really important at preventing hypothyroidism. So you've seen maybe recently that women are experiencing like a 287% increase in hypothyroidism risk on oral contraceptive pills or birth control pills. That is because of the decrease, partly and because of the decrease in the trace minerals. So again, all these things are supplementing, but oral contraceptive pills actually do increase some things like cadmium, not good. It's a heavy metal, copper, iron, calcium. It's like a hot mess express of depleting things we don't want and raising levels of things, depleting things that we do want and raising levels of things that we don't want to raise levels of. Just trying to supplement for all these things is crazy. And like monitoring is crazy for something that has alternatives. So oral contraceptive pills also have not just been marketed for preventing pregnancies. They're handed out like candy, in my opinion, for acne, dysmenorrhea, menorrhagia, that's painful periods, and for heavy menstrual bleeding, irregular cycles in general, kind of trying to regulate polycystic ovarian syndrome, just ovarian cysts in general. A lot of teenage girls will have an ovarian cyst and they go to the emergency room because they're in so much pain. And then they're referred to a gynecologist who puts them on oral birth control pills to regulate these cysts instead of looking at the clues of why we have these issues. Also really heavily used in endometriosis, which is crazy because of what endometriosis is. I mean, it's a whole nother issue for another day. Just so many things, uterine fibroids, the list goes on. Okay, so we got that down. I also want to just bring up this new idea it's not a new idea, actually. It's been out there for a while, but it's been gracing like TikTok and social media platforms recently. Okay, so you have something called major histocompatibility complex, MHC, and this happens during regular cycles, okay? You're likely to prefer certain individuals by the way that they smell around ovulation. But when you're faking your cycle because of hormonal contraception, you're not in tune with that response and it alters who you're attractive to. So, okay, who cares, right? Well, when you cycle naturally, you're likely to select partners with a more genetically diverse background, more masculine, more symmetry to their facial features. But when you take hormonal contraception, you're likely to actually select a genetic makeup that's more similar to yours and someone with more feminine features. And research is starting to show the possibility of mate choice and fertility. And infertile couples are likely to share more of the same genes. And it's also shown higher rates of recurrent miscarriages. So a lot of women now are worrying too, oh my God, if I go off the pill, I'm not going to find my partner attractive anymore, which is crazy, but real. And lastly, I just kind of want to circle back to the potential risk for cervical cancer. So there's an association between hormonal contraception and cervical cancer. And hormonal contraception inhibits your body's natural ability to fight off HPV. You're 85% less likely to fight it off versus someone who's not using hormonal contraception. And chronic HPV does increase your risk of cervical cancer by a lot. And I will mention too that hormonal contraception also it's proven by research to increase the risk of breast and liver cancer. But what's happening is these risks of cancers are being minimized because there is also a slight decrease of endometrial, ovarian, and colorectal cancers when you are on hormonal contraception. So you're like, okay, well, some of them are decreased, some of them are increased. So who cares? It's kind of a wash. Well, for what it's worth, the International Agency of Research on Cancer has classified oral contraceptives as a group 1 carcinogen due to a clear link between hormonal contraception and cancers of the cervix, breast, and liver. So, and I think about this. I'm grateful that the pill is an option, right? But I'm more grateful as a woman that I have the freedom to cycle naturally. And I recognize the power of how my body works together and how hormones affect every single part of our body. Not one part of our body is untouched with receptors. And hormones aren't just about preventing pregnancy, and not to mention hormonal contraception. There may be so many effects of it that we don't even know yet. There's a huge rise in infertility, and it's a newer thing for it just to be so run of the mill, and it's just getting worse and worse and worse. And I can't tell you how many women we see weren't told of the risks of going on oral contraceptives or weren't told about putting their daughters on oral contraceptive pills at such a young age with the anticipation that they're just going to stay on this until they want to have a baby. Why is this? Well, medical establishments are okay with the sacrifice of a few versus the good of many. And while that may be a very philosophical debate in theory, I think that every person in this world deserves a choice, and informed consent is something that is huge for me. I look at it like when they look at the research and they see that, yes, women are affected by these hormones differently than some other women. They're blaming certain women for being sensitive to these synthetic hormones. But I just think when you look at like a crime of a sex act, for example, and maybe a woman was taken advantage of, and to me, saying that about like women just being sensitive to hormones, I liken that to like blaming a woman for how she was dressed when it happened and not looking at her perpetrator and blaming him. And so when I look at the major hiccups of what hormone contraception is causing in our world, why are we blaming women and their bodies? Why aren't we looking at these synthetic issues and potentially working on other options for preventing pregnancy, let alone all of these other things? Just because it works and prevents pregnancy doesn't mean that it's worth it for these women to take these drugs for the rest of their lives or until they want to have a baby. And especially not for the adverse profile that we can see. So while I might not be in charge of the guidelines set by ACOG, I hope that more healthcare providers will become more discerning and better screening of their patients, at least for these risks. Just because a medicine is preventing pregnancy and effective at doing that, it doesn't mean that it's worth the risk for any woman. I think that it's vital that we are fully informed consent. And, these medical establishments often prioritize the good of many over few, but I just really think that every woman deserves to make her own choice, have informed consent. So anyway, thank you for tuning in to this important episode of the Curated Beauty Podcast. Remember that your health is wealth. Stay informed, stay empowered, and always advocate for yourself. If you have any questions or want to share your experiences, feel free to reach out to us on social media. This amazing functional medicine page that we are building is called @B, Cultured Wellness. We'll put it in the show notes. And also you can follow our main page based on medical aesthetics, which is at beautyculture.medspa. Until next time, take care and be well.
And that's a wrap on another enriching episode of the Curated Beauty Podcast. If today's conversations resonated with you, I urge you to share it with someone you believe could benefit from it. Let's spread the beauty, knowledge, and empowerment far and wide. For more in-depth resources, information about who we are, or if you're interested in becoming a patient or training directly with me or one of my team, visit our website at beautyculturespa.com. Don't forget to stay connected with us on Instagram for all the latest updates, behind the scenes, and beauty wisdom. Follow us at beautyculture.medspa and at B Cultured Wellness. That's the letter B, Cultured Wellness. Thank you for being with us today. Keep curating your beauty both inside and out. Until next time.